Hi, I'm Paul Feiner. I'm the Greenburgh Town Supervisor.
I'm Pauline Mosley. Welcome.
And we have a series called Solving Problems. And what we're trying to do, Professor Mosley and me, we're trying to help people solve problems that may come up in their lives. So, Pauline, would you like to introduce our guest, Georgie Kovacs?
Sure. So today we have Miss Georgie Kovacs, who has a very inspirational story for everyone who actually had a problem. And she's going to share with us and share with our listening audience how she solved this problem. So I'm going to turn it over to Georgie to tell a little bit about her story, her problem, and welcome to our show today.
You're a great host because now there's so much suspense. Now I want to know.
I know. I'm like, oh my goodness.
Right.
So I'm Georgie Kovacs, and I host the Fempower Health podcast. And it definitely speaks to women, but for the men who are listening, I think some of the things that I'll be sharing today will be relevant to men and women. So my story is that I had gotten married, and right away I started to have children, or tried to start, and I went to my OBGYN, and right away she said, you need to go to a fertility doctor. Now, for background purposes, I've worked in healthcare my entire career, working for biopharma companies, and I've also consulted for them, was a chemistry major, so very comfortable with science and doctors. And I started going through these treatments, and I was learning my body, I was learning about fertility, I was learning medications, how to inject myself, you name it. And over the course of 4 years, I kept being told it was unexplained infertility. And fortunately, I lived in Manhattan. Fortunately, I knew healthcare very well. And so I was able to navigate, but I still couldn't find answers. And it was the 10th doctor who helped me understand that I had endometriosis, which I can talk a bit about that as well. But for the story of this, I was really frustrated because I thought, I'm so fortunate. I have access, I have the knowledge, and I couldn't even find the answers. And through that experience, I was inspired to create this podcast. And originally I was going to focus on fertility, but as I learned so much more about the healthcare system, I realized that there's so much in women's health, and a lot of this applies to all of health, that we didn't know. And so my goal has been, why don't I find that 10th doctor who's the true expert in their different areas and interview them and help people hear from them, so that if people are struggling to find answers to their own health questions, they would be much more empowered by hearing from these experts and have much better conversations with their clinicians.
It's interesting because last week we interviewed a guest who has a website dealing with rare illnesses. And this is a nice follow-up.
Absolutely, I thought
to that.
Yep.
So your podcast could be a lifesaver for a lot of women.
Yes.
And men.
Yes, absolutely. Like one of my favorite responses that I got for feedback from a listener was, I binged on your podcast and I was able to put together pieces I never understood before. And now I know how to talk to my doctor. So that I could get the answers I need. And that's really what it's all about, is that proactive, being able to talk to your doctor. And because I interview so many clinicians, I hear from them what they're hoping patients will do, which is applicable to any gender.
And how did the whole situation with yourself end? Yeah.
So I have a son who is 8. Wonderful. He's in 3rd grade. Love him to death. And, what was really frustrating, though, which is why the 4-year part is so relevant, is I was 41 when I had him. And so my journey was over. And you hear that with so many conditions that many people face, is they're struggling. They're trying to find answers. They're going to doctor after doctor, being dismissed. And there's just so much in healthcare, like the 10-minute doctor appointments, the way physicians are reimbursed, like all of that influences our experience, and plus our own knowledge of how to go to a doctor appointment properly so that we can get the help that we need.
It's actually very inspiring, not only inspiring, but a lot of women who are going through fertility, issues. They may be depressed. They may be dejected. They may think there's no hope. And when they hear your story, they'll keep trying and won't give up. Is that one of the goals of the podcast?
Absolutely, and it's honestly not fertility. It's how I entered it, and this is what's been interesting to me in the years that I've been interviewing these experts is, all of us. I mean, again, my focus is on women, so I'll try to speak more generally. But we're all busy, and for women especially, there's so much data around how even if we do go to the doctor, we're dismissed. A term that's really hot on social media right now is medical gaslighting. And when I talk to these doctors, I ask, like, even the male doctors, because I don't want it to come across like this women think doctors are bad or men are bad or anything like that. And, we really do hear how it's just such a struggle because the way research has been done in healthcare, it's basically been on men and then everything is applied to women. And we're now finally, even though the FDA mandated it in 1992-3 to have women partake in clinical trials, we're still far away from what we need. And so these learnings really apply to, so many different conditions, sexual health. Honestly, for men, they're able to have all these ads explicitly talking about men's sexual health. Ads for women's sexual health are being banned. So there's a group actually that's trying to ensure that those ads aren't banned. So this spans into so many different areas, but we tend to enter when we're pregnant, struggling with fertility, or struggling with menopause. So, it's very complicated, but yeah.
So I wanted to ask you, Georgie, so how did you become so resilient to keep going after the 10th doctor? Because I think so many people, when you have an illness or situation, after the first doctor, maybe you get a second opinion, maybe a third, but how do you get what constitutes the characteristics to keep going for the 4th, the 5th, the 6th, the 7th, the 8th? I mean, what made you keep going?
Well, for me, I really wanted to have a child, and I tend to be really focused on things that I want, and I really dove in. It was crazy. I was a consultant. I had a client in California. I commuted every week, so I ended up having like a staff of healthcare providers in California and in New York, and we scheduled all my injections and medication deliveries and whatnot across the country. It was crazy, but I just really wanted it. And what I hear from those who are struggling with many, many things, like, post-delivery, many women will struggle with like prolapse and obviously postpartum depression and all of these factors. And I think it's really when you're really struggling, you can't give up because you're either suffering or stressed. And I think a lot of people who are at that point are the ones who really try so hard to get the answers. And that's been one of the themes that I've seen in the people that I interview. Yeah.
And it's a podcast, and do you like archive the podcast so people could listen to it on a website?
Absolutely. So you basically can type in Fempower Health where you listen to podcasts. So Apple, Spotify. I now started posting the episodes on YouTube in case people wanted to see them on video. So those are slowly getting uploaded. Then on the website, which is fempower-health.com, I have organized all the topics because over the years I've covered 16 topics, and because not everything is going to be relevant to everyone, and the podcast feeds are just based on an algorithm, people can go to the website and find exactly what they want.
That is great. Are there a lot of other organizations that do similar things, or do you feel your podcast is unique?
I would say there's a lot of women's health podcasts, and they all focus on different things. There are some that just focus on menopause. There are some that mostly focus on like menstrual health and hormone health, but we're all kind of evolving into talking about these broader topics. And what's great is it's so good to have so many, because people are going to want to hear from certain types of guests, or maybe the host Like someone may not like my voice, and so they want to listen to someone else, and that's fine. But it's honestly been great that there are so many people who are working on creating that education because it's so needed.
Is there like a link to, say, on your site or anywhere else? So let's say you're dealing with, I'm just throwing out, say, fertility issues, where there'd be like a whole list of organizations that might be able to help, like a one-stop, shopping. You go on a website and there's like 10 bits of advice that somebody could get.
Right. So the way the website is arranged now is when you pick the topic that you want, there's the podcast episodes, any blog posts, and then any resources. One of the common resources that I've been finding, because as I've been doing these interviews, I'm finding that there's all these subspecialists. And until you've been on the journey, you don't really realize that they're there. So for a lot of the conditions, there's actually specific types of doctors they should go to. So like a fun fact, because everyone's been talking about menopause, back in 20 years ago, there was a Women's Health Initiative study. And because of the way they analyzed that data, it basically said hormone therapy is horrible, it's going to cause cancer, and essentially people stopped prescribing hormone therapy. And it really, created a negative impact. And so now only 30% of med schools train clinicians on menopause. I'm assuming that's going to change now because they've reevaluated the data. And so I hear so many women, as an example, complaining, why does my OBGYN have no idea how to help me? And so on the website, I have resources of like, well, this is how you find an OBGYN who knows how to deal with menopause. So these are the nuances that most people don't have. So it doesn't even have to be cancer or infertility. It can be, I have hot flashes and my doctor can't help me. And so I've really just gathered all the resources, the articles in New York Times and whatnot that talk about this.
That is great.
Yeah.
So could you just tell us again the website?
Yeah, it's fempower-health.com, and it's FEMPOWER-health.com.
And how often do you do podcasts?
Every week. And so I don't do new episodes in the summer and over the holidays, so I rerun older ones, which is great because of just the way things show up in your feed, so if you missed it in a previous time. I also have a newsletter that I publish every week, and it'll summarize the podcast that went live that week, any other specific health events, and also health news, because people want to be up to date on the latest things that are happening. And so I share all of that. And then I now add polls in there so people can give feedback on what they want to hear so that I can continue to provide what people need.
Do if people email you with questions, do you answer those, or do they basically get information more from the podcast?
It's mostly through the podcast, but the feedback is how I leverage it. So on social media, there's discussions there, and it's funny, people don't email. It's usually just because we live in this society, everything has to be quick and easy, and I guess email is like not the quick, easy thing anymore. So, but any way that people do email me to answer your question, I definitely, I don't give out my number though. Can you imagine the phone calls I would get from everyone? But no, through email and social media and on the website, there's always ways to get a hold of me, and I'm happy to answer questions.
Do you deal with support groups also?
I haven't specifically. If there are some, like for example, with fertility, there's a great organization that really helped me. It's called Resolve, the National Infertility Association. And so if there's groups like that, then I do post about them.
This is really great because there's so many people who could really be helped by the information that you have.
Absolutely.
And you're doing a lot of the work for them.
And I do want to share something that's really, really, really important, regardless of the condition that you have. What doctors are saying is we need people to come to us with a very specific question, and then them tracking as much information as they can and providing that to me so that I can better help them. So what is hard for clinicians is when someone comes in and gives a laundry list, because it's impossible in those short appointments. Obviously, if you're dealing with cash-paying physicians, they have a lot more time because their billing structure and time structure is very different. And also there was an interesting market research study someone shared with me where they said that a doctor will come in and say, "Hi, how are you?" And the patient thinks, "Oh, just like talk about your vacation," and then start with the laundry list. The doctor actually means like, no, how, like, this is where you tell me what is the thing you're here for, and what are the 10 things that, make this the priority issue we need to talk about today. So it's really upon us to not expect our doctor to read our minds, know the history of everything that's happened to us since we last saw them, and magically come up with a solution. We need to play a part in our own health as well. And that's where the podcast comes in, because it's like, to you, everything that's happening to you is normal. Unless your body's screaming, you may not know. And so it's like, why not be proactive about the important things so that you know what to talk about? You know when there's a change that's happening. So like one example, concrete one is menstrual pain. You should not have pelvic pain. And if you start to monitor, like, when does it happen? What causes it? When does it get worse? When does it get better? And then go to your doctor and say, I have pelvic pain, and give that information. You can help, but just also know that it's not normal.
I wanted to know, could you speak to help our listening audience and viewing audience as well, what are the characteristics of an expert? Because you can go to a physician, but how do you differentiate whether it's an expert you're working with or not? Because your podcast, you've seemed to pull together these experts. So could you define, when you say an expert, what is an expert, and how we as laymen going to, our clinicians would be able to differentiate whether we're with an expert or not, and how to find an expert?
Right. That's a really good question. I think it's a complicated answer. So I will start with, at the end of the day, your doctor has to listen to you. And so if you're sharing something and they're dismissing it, like, I'll give a concrete example. Before all the apps, I used to track my cycle on a piece of paper, and I would circle all the things. For those in the fertility world know exactly what I'm talking about. I went to this doctor and I said, I would like to show you my tracking chart. He said, I don't need that. I know exactly what I'm going to do. I'm like, but this is the information about my body. So I fired that doctor. So, part one is, do they listen to you? Because all of these doctors are trained. I think that the bigger challenge is when you have things like pelvic pain. There are pelvic floor specialists if you're having like prolapse and things like that. If you're having pelvic pain, there's a lot of different subspecialists. And so I think you kind of have to go to that primary doctor, whether it's the primary care OBGYN. And if they're not referring you when things aren't getting better, that's another red flag. So then when you get to the subspecialist and you want to figure out who's right, again, it's, are they listening? But then if you're going to do a surgery, as an example, like endometriosis is a great one. It's 1 in 10 women that have it, at least. And it takes about 7 to 11 years to be properly diagnosed. Now, the surgeons, there's a few that are truly specialists. So if you go to someone like that, questions you ask are, how many surgeries do you do in a given month? If they do like 3, that is not going to be the doctor that you want to go to, because endometriosis is incredibly complicated. And there are so many people who still have pelvic pain because the surgery wasn't done properly. So, and that's what you'll find on the podcast. So it's a complicated answer, but start with, are you being heard? And then when you meet with the doctor, ask, how many of these types of patients have they treated? What have been the outcomes? Obviously look at reviews, seeing what kind of training that they've had as well is also important. But again, I think the biggest is, are they listening to you, and do they really seem like they want to help, or are you being dismissed? That's like the first red flag.
That is really, interesting. I wonder if you could sort of partner with some of the hospitals, and it would be really interesting if somebody is, has surgery or they have a medical condition. People really don't know how to choose a doctor. Do they get a second opinion? What are the questions? What are what are some of the pluses and minuses that they should consider? And it would be really a great service of the hospitals to publicize, what you're doing, but, maybe some of them wouldn't want to publicize it because maybe some of the doctors would not meet the criteria that you have. From your experiences, have you found that, most doctors are like fantastic, or do you find it frustrating? I remember once I knew somebody who had a family member who had a medical problem, and he saw a doctor in the hall, and he said, "Doctor, I'd just like to ask a question." And the doctor said, "As long as you make it quick." And the person was had a really major issue, and the whole family was all stressed out. And a lot of doctors really are not as empathetic as they should be.
Right, no, absolutely. And I guess that's why it goes back to, it's the basics. Are you being heard? And I think, it's the other thing too is doctors can also say, I can't help you, or there isn't a study right now on this. Let's figure it out together. Let me talk to some other people. So I think at the end of the day is, do you feel like you're getting helped? Because a lot of things are really complicated. The data isn't there yet. And we have a really complex healthcare system. I hate to say it, but I hear this from even clinicians that, so I'm also a healthcare consultant, and incentives and structures drive behavior. And so if a doctor is incentivized on patient satisfaction, even though he or she definitely wants to help the patient, subconsciously as a human being, if that patient is demanding a certain thing, then I could see how possibly a doctor may be like, oh, well, I'm rushing and this patient really wants this, and to get the review. Mm-hmm. And again, not malpractice. I don't want anyone to think I'm saying that, but it's just these nuances like, am I going to debate the person on an antibiotic? Okay, fine. So I've heard stories like that as well. And so, it's so complicated. I wish there were such easy answers.
I had another question. You said you were also like a healthcare consultant.
Yes.
Let's say somebody has a medical issue. They listen to your podcast, but they would want like more information. Do you also, or have you thought of like expanding your business and providing one-on-one advice? Because let's say somebody's going to, let's say somebody has, it could be any issue, and they really don't know what to do. It would be nice if you could almost like hire somebody who would be able to select the doctor for you, help you go through like second or third opinions, provide some encouragement. So like an example like you had with your situation before you gave birth, that could give so many people a lot of hope. And if somebody's like stressed out, have you ever thought of that?
I have. Some people have suggested it. And, what I would say is it really depends on the condition, because you want someone who's an expert. Like, I am not a trained clinician. And so, but I'm very good with process. So from a process perspective, I can give perspective and just from the experts I've spoken to, but because I'm not a clinician, I'm very limited. But I have learned that there are certified patient advocates, and I have to look up where you can find them. But I do know that they do exist, and those might be people.
It would be more like a concierge service for people who are going into the medical, who are having surgery. They don't know what to do. They might not be sophisticated where they're just going to the first doctor.
Yep.
And that might be the wrong doctor, and that could be life or death for people. That could be a really great profession.
It would be great, and I have thought about it. I think it's really just where the demand is, because there's a lot of really great startups, and that's actually something I'm going to start writing about in my newsletters. All these apps and other companies that are really trying to solve these problems. But at the end of the day, unfortunately, healthcare is capitalism. And so there's so many great things that we know need to be done, but no one's going to pay for it. And so we're kind of stuck with how do we help people, but also know that we can pay the bills to be able to run the business to help the people. And it's a reality, and we all know that it's terrible, but that's just how it is.
Right. I think your podcast and your website is a phenomenal resource for everyone because like you said earlier in our discussion, most people don't have the time. This is a very time consuming journey when you're trying to find a doctor. Most doctors, to get an appointment, sometimes if you're lucky, you get it within a month. Sometimes you have to wait 2 and 3 months. So to have a resource where you can go and have all this information available without having to go and do this information is fantastic.
Thank you.
And also to know what questions. Now on your website, does it have like certain set of questions? Like you mentioned earlier, like what questions, when you go to the doctor, what questions should you ask? So
Right.
Is that on your website?
Not yet. I mean,
Not
I'm
yet,
a one.
okay.
So the other part of my story is I'm a single mom, full-time job, doing this on the side, and so there's
Wow.
lots of things, and so I'm really following what comes my way as far as what people want and trying to prioritize it in the limited time I have. Again, capitalistic society, have to
Right.
pay the bills.
That's right.
But one thing I do want to say, because I know we're going to be closing soon, is one cool thing that I've heard is I had someone approach me, a gentleman, and he said, I listen to your podcast so that I can be a better husband, father, and brother. So that was like really, really cool,
That's
especially the sexual health section people.
And again, we only have like a couple minutes. What's the website again?
It's fempower-health.com. So it's FEMPOWER.
And is there like a contact information if people want to email you?
Yep. Once you get on the website, like you can get sign up for the newsletter, and then that'll be a way to stay in contact. There's all sorts of different ways depending on. It's all on the website because some people may want to use social media, so it's all on there once they check out the website.
That is great. And what are some of the upcoming podcasts?
So next week concludes the 3-part series on psychedelics. I was going to do that in one episode, and once I learned more, I knew I couldn't do it justice. I'm actually doing a 4-part series on endometriosis because it is, such a common condition that's very complex. So we're really breaking down and getting into a deep dive there. It's a really popular topic.
But this is really great. I will definitely encourage people to listen to your podcast.
Thank you.
And take a look at your website. And there's other organizations in the county that deal with women's issues. The Pace, the Women's Center. That you have the County Office of Women. So I'd be happy if you want for me to introduce you to some of the county groups, and then they could hopefully help you with networking and sharing information.
Thank you. I appreciate it. And again, I welcome people to share feedback because that's real. I'm here to serve the people who really need the information. And because I interview so many people and read so many books, it's like so much information in my head. So the feedback is actually really helpful.
Yeah,
Terrific.
this has been
Thank you.
awesome.
Thank you.
Yeah.
Great. And thanks for joining us.
Thank you.
Thank
This
you.
was wonderful.
Thank you.